Has anyone you love started acting differently this past year? Subtle changes that seem small at first? Many assume death in old age is sudden, but the truth is, the body sends warnings months, sometimes a year before. Most people miss them. By the time they realize, it's too late to prepare, too late to make final memories. In this video, we'll cover 5 key signs that often appear a year before death, signs that seem like normal aging but mean something more. Recognizing them early can help you provide better care, create meaningful moments, and ensure comfort. Stay until the end, so you don't miss any of these crucial signs. Let's get started. Number 1. Unexplained weight loss. One of the first signs is noticeable weight loss, not from dieting, not from exercise. They eat the same, but their clothes fit looser. They might say, "I'm just not as hungry anymore." The body is struggling to absorb nutrients, muscle mass decreases, strength fades. They tire easily, feel weaker, have trouble moving. A weakened immune system makes them more vulnerable to illness. If they catch a cold, it lasts longer. If they get an infection, it's harder to fight off. Encouraging them to eat more won't always help. The body is shifting, preparing. Instead, focus on easy-to-eat foods, hydration, and comfort. Weight loss isn't just a number, it's the body sending a message. For some, this weight loss happens gradually, a pound or 2 a month. For others, it's more sudden, a noticeable drop in just weeks. You might notice changes in their face. Cheeks become hollow, collarbones more visible, hands thinner, veins more pronounced. You might think, should we try supplements, extra meals, more calories? Sometimes it helps, but often the body won't accept it. If they feel full after a few bites, don't push. Instead, offer small, nutrient-dense foods. Smoothies, yogurt, soups, things that are easy to swallow. Hydration is key. Dehydration makes everything worse. Encourage sips of water, herbal teas, or electrolyte drinks. And most of all, comfort matters. Let them eat what they enjoy. Now is not the time for strict diets. If they want ice cream, give them ice cream. Number 2. Extreme fatigue and weakness. It's not just feeling a little tired, it's deep exhaustion that doesn't go away with rest. Getting out of bed feels like a chore. Simple tasks, dressing, walking, even talking, take too much energy. The heart isn't pumping as efficiently. Circulation weakens. Muscles don't get enough oxygen. The body is conserving energy for what matters most. They nap more, sleep longer, struggle to stay awake. They lose interest in activities they once enjoyed. They start withdrawing from conversations. This isn't laziness. It's not something they can push through. It's the body slowing down. What they need now is patience, understanding, and comfort. You may notice them sitting in the same chair for hours, or falling asleep mid-conversation. Tasks that took minutes now take double the time. If they say they're tired, believe them. Don't push them to try harder. Instead, adjust to their pace. Help them conserve energy. Make things easier. Place frequently used items within reach. Use a wheelchair or walker if needed. Assist with dressing if buttons or zippers become too much. And most of all, let them rest. Their body is telling them what it needs. Listen to it. Number 3. Cognitive decline and withdrawal. They start forgetting things they never used to. They repeat themselves, lose track of time, get confused in familiar places. The brain needs oxygen, but circulation is weakening. They might have moments of clarity followed by confusion. Socializing becomes overwhelming. They talk less, engage less, sit in silence more often. Not because they don't care, but because it takes too much effort. Mood shifts happen too. Some become irritable, others grow quiet, detached. If a loved one is pulling away, don't take it personally. They may not respond like they used to, but they can still feel your presence. Speak gently. Reassure them. Meet them where they are. Forgetfulness may start with small things. Misplacing items. Forgetting names. Repeating a question they just asked. As it progresses, they might forget major details. Birthdays, addresses, faces. They may struggle to follow conversations. Lose their train of thought mid-sentence. This can be scary, for them and for you. The best thing you can do is be patient. Correct gently, if at all. Sometimes it's better to go along with their version of reality. If they think it's 30 years ago, let them talk about it. If they think a long-gone loved one is still here, don't argue. Instead, ask them about a favorite memory. Number 4. Frequent infections and slow healing. They start getting sick more often. A simple cold lingers. A small cut takes weeks to heal. The immune system is failing. Pneumonia, UTIs, skin infections all become more common. What once was minor now requires stronger medication and longer recovery. Sometimes, infections don't show obvious symptoms. Instead of a fever, they just seem more tired, more confused. Their body is losing its ability to fight back. This is when families often push for more treatments, more antibiotics, more hospital visits. But at some point, the focus shifts from curing to comfort, keeping them hydrated, keeping them clean, minimizing stress. These make the real difference. Number 5. Changes in breathing and circulation. Breathing becomes slower, more shallow. Sometimes they pause between breaths. Other times, their breathing speeds up, then slows down again. Circulation weakens. Hands, feet, nose, ears, cold to the touch. Skin turns pale, even bluish. They feel winded doing simple things, sitting, up, speaking, shifting positions. A persistent cough may appear, or a gurgling sound when they breathe. These aren't just random symptoms. They're signs that the heart and lungs are weakening. The body is conserving energy, preparing for the final transition. There's no fixing this, but there is comfort. Keeping the room cool, using a humidifier, offering small sips of water. These small things ease discomfort. Final thoughts. We've covered 5 signs that often appear a year before death. Unexplained weight loss, extreme fatigue, cognitive decline, frequent infections, breathing and circulation. Changes. These aren't signs to panic over. They're signs to prepare. Instead of trying to stop the inevitable, focus on making their final months peaceful. Be present. Share stories. Let them know they are loved. If you've noticed these signs in someone close to you, take a deep breath. You're not alone. Many have walked this path before. If this video helped you, leave a comment below. Tell us what you learned and how it applies to your life. And if you haven't already, subscribe and turn on notifications. Your support helps us keep creating content that matters. Thank you for watching. We'll see you in the next video.